In 1970, Nigeria had its first cholera outbreak, and since then, intermittent outbreaks have been occurring. The most severe outbreak was in 2021, when approximately 111,062 suspected cases and 3,604 deaths were recorded in 33 states and the FCT. In subsequent years, we have recorded a minimum of 20,000 cases annually, affecting similar states as in 2021, and still ravaging the country.
Cholera is a problem in Nigeria. It's a problem that affects fellow citizens, often those that are at the lowest end of the socioeconomic ladder, that are suffering inequitable access to health care and general socioeconomic deprivation.
It's a classical sign that something is actually wrong. The symptoms include diarrhea, large quantities of diarrhea, profuse watery stool, which is commonly referred to as rice watery stool. Other symptoms of cholera include vomiting, leg cramps, and weakness. Disease is associated with a lot of loss of water, so there's high degree of dehydration in severe cases. If not properly managed, patients can actually die.
Amụrụ m ụmụ ịtọ, ụmụ nwoke ịbụọ na ofu nwanyị, mana ọrịa na m ofu nwoke n'ime ha n'ime abalị. Ọnọgide bewe akwa, nna di m akpazi ya eduru ya jewezie na ụlọ ọgwụ. Mgbe ọrụ ndị ahụ nọ that place, mgbe ọrụ ahụ gbasa ọpụn n'ebe anọ ka m mụrụ this baby. Na enweghị ike ime ebere na m mụrụ nwa ebe a. Na enweghị ike isi kunu treat this baby as knock at the too tender. Otu anụ ha ọdụgọrọ week maka afọ ọsa. Ekwe odu, odumaya. Ihe ha na-ekwu bụ ọbụzi na m mụrụ ebe anụ ọna mama ndosizi deposit before a treat na ọ ga-akọsikwa nnukwu ego. Mkpọwokwa my husband ka ọ bịa. So n'ụlọ ọgwụ a na-ebe akwa maka na ihe na-ebere akwa bụ na the child is weak and ọ bụrụ ya ha na-akọ that place. Ọ bụrụ ihe na-akọ ka ha na-akọ. Si ya doctor maka ego. Maka ego. Una na-enekwe this child. Maka ego. Ka the child is weak. Onwe ozi. Anyị ekpegide ma oxygen, ejepata oxygen tinye nwatakịrị otu aka ọ na-eme. Ọ na-eme okweghị na ya ga-anabata that oxygen. Emegide. Anyị na-anọrụ. Ọ na-eweta aka ebe after 6. After 6 ọnwa ụbọchị ụka.
To wani abu da ya faru da mu, muna yin wanki da ni da ita domin kusan gama hama, sai ta ce ba ni da lafiya. Sai na ce me isa me ke, ta ce wallahi gudawa ma nake yi. Sai na ce to ki je ɗaki ki ɗauko magani ki sha. To ta ce ta balla, sai na ce ki bar wankin. Sai ta fita waje da ƙawayenta sun zo gunta. To shi kuma ƙaninta ya yi shi ma amai. Sai na ce to goya yi ki kai shi. Ita ce ni ma jikina ya yi sanyi ba zan iya ba. Sai na ce to shi ke ne na tambayi mai gidan ice je kike kai shi. To bayan na kai shi tana kwance a kan gado kuma sai ta na ɓaɓɓallo magungunan ma zan bashi sai ta kama amai. Da yaron da magungunan sai na ijiye shi sai na yo kanta. Sai na ce ya aka yi, sai ta kama kashi sai na ɗauko kofu. Da ta yi aman sai na kai ban ɗaki sai na kiran mutan gidanmu. Sai na ce kun ga ita ma Ruma ku zo ku taimaka mu, kun ga ita ma abin da ya same ta. To sai mai gidan na ya ce a kai ta asibiti. Ana yin ruwa ne aka samu dan a caɓa muka hau sai muka tafi asibiti. To mun je mu an ƙara mata ruwa an yi komai aka dai da daddare ta ce a bata ruwa a bata ruwa a bata. To sassafe dai haka dai mun yi sallah a gaggauci tana kaiwa dai tana kawowa. To sassafe kuma ita ce gagarin kuna shine Allah ya mata rasuwa.
basically the problem in the state is issue of water, sanitation, and hygiene.
According to Federal Ministry of Water Resources, only 10% of the population have access to complete clean water, proper sanitation, and good hygiene practices.
Well, if you look around, you see how they are living. They are living in a cluster. This is a cluster settlement, and you see it affects them because one, they have one source of drinking water.
And the side that they born and one and the mother and mother. The other side, Nania, they bend the mother, the when they send it. I some tank, the channel, various village I want to visit. But for me, one about them, we're buying me that tank.
On the reach 2 hours, Ije Kutia Bata. Anyu manshina koko mid. Ma dirty, mmiri nwee ike izokịta ofutekwu more dirty tinye ebe ahụ tinye na mmiri ahụ.
Shi za mu ɗebo mu girki, shi za mu iba mu sha, shi za mu iba mu wanka. Daga mu har yaran mu gaba ɗaya.
To a har yanzu kuma waɗansu in sun ɗebo ruwan suna iya dafawa, sai sun dafa shi za su yi amfani da shi. Amma waɗansu babu ruwansu da wani dahuwa.
Anyị nweghị toilet. N'ime ọfịa ka mmadụ ncha niile na-eje toilet. Ma ndị bịara abịa n'ebe a ma ndị bi ebi. N'ime ọfịa ka na-eje toilet. Ndị ma n'ime ọfịa ahụ n'akụkụ ya mmiri zoo kịta. Ovuri ahụ vube n'ime mmiri.
Ngacha toilet na n'ilo nnachitekwe nkwa aka m sometimes uche mmadụ amambịa dụrụ like na nke a.
Some of the LGAs, in the communities the LGA, they see practice open defecation, then very poor hygiene, and in fact poor sanitation. Okay, I know cholera, when you have poor sanitation, poor hygiene, and then they don't boil their water, the water available, shortage of water. So, and especially during the dry season. Then during the rainy season, when they practice open defecation, and you see some of these when it's raining, the water flows through the river, washing out the feces, and and they drink. If they drink the water or use it to cook their food, they can also predispose to cholera outbreak.
Tidar an sami wannan rashe-rashe a mai da gudawa sama da mutum kamar kusan 100. Kamar irin wannan gidaje namu haka, wannan wani gidan za a samu mutum 2, wani gidan za a samu kamar mutum 3, wani gidan kamar mutum 5 ma suna fama da amai da gudawa.
When you say cholera killing people, is it not the community that it's not too prominent in the cities, although we may find them at least to some extent, but in the community you have such a gap being many in the community.
Around 1991, 1996, 2000, 2004, and the most recent one is in 2021, when the state experienced the largest outbreak it has ever recorded, with almost about 20,000 cases recorded in the state, and with over 200 people dying from the disease during that outbreak in the state.
Outbreak of cholera comes with its consequences in the livelihood of the affected community. It impacts on the economic, social, educational sectors, and many more. The economic challenge includes loss of productivity and spending much money to forestall or control the disease and premature death of future workforces.
Wannan itina'i ne dai isa wa yaran suka dakata da zuwa makaranta.
Wannan amai da gudawa ya tarwatsa mana abubuwa da yawa. Ba ma iya zuwa kasuwa barantane mu tafi noma ko wani dan guri haka inda za mu samu wani abu. Gida ya riga ya gama wargajewa.
We see how people are suffering it really causes a lot of, if it affect economic standard of, of the state, not only the community, because being part of the state actors for controlling the cholera in the state, we find out most people are having a lot of issues with regard to controlling at household level as well as the community. Water supply is a problem, a poor environmental setup is the problems, and we find out some people who have already been engaged or who have already been fall into victims of cholera, which really show that those people they may end up having a lot of issues with regard to human development in terms of economic standard, in terms of living standard generally. It really affects both angles, in life.
Cholera is a highly sensitive, indeed highly specific indicator for poverty and socioeconomic deprivation. So targeting the hotspots with a multi-sectoral intervention of WASH, of vaccination, continued surveillance is certainly an effective way to reduce suffering and to reduce deaths.
Still on the impact of the cholera outbreak is social humiliation, as some people stigmatize those affected by it.
Gaskiya a lokacin na ji rashin daɗi kuma wanda yake mai yawa, domin wannan rashin daɗin wato ya ja min abubuwa masu yawa na tashin hankali, sakamakon su al'umma suna ganin ma kaman kawai iya nan gidan ne kawai wannan abin wannan Allah ya saukar da iya wannan ibtila'in kadai. To wannan ya sa mutane suka tsangwami gidan, suna ganin ko abin daga gidan ne. To wannan abin ya haifar mana da rashin jin daɗi mai yawa kuwa.
Aka ce gidan malam awai sun marasa lafiya ne, kazanta marasa lafiya ta sa larura amai da guda ta afka masu. Yawa aka ci gaba da haka ana ta faɗa a gari, to kuma ikon Allah da ke Allah ne mai saukarwar, ɗaya bayan ɗaya wancan ikamu a gari duk ya bayyana.
Realizing the negative effect of the disease, state governments at various levels in collaboration with partners are leaving no stone unturned to ensure that not only cholera is prevented but also eradicated.
Kaman wannan bayi da ka tambaya, mu muke haka abin mu da yara. In muka yi mu dan samu dai itacen mu kaman na gargajiya dai mu rufe abin mu. Sanda Allah ya kawo ice kan mu rufe shi shikenan a koma ni kaga gidan namu akwai wada girma ko? To gaskiya a haka muke yi. Tunda ba mu da karfin da zamu irin ta waje din nan da ake yi.
What we did was to identify line MDs that are into WASH, like Baseva, Ministry of Water Resources, Ministry of Environment, and Bauchi State Urban and Sewerage Corporation. These are some of the key stakeholders that are into WASH. We identify them and collaborate. We work with them toward eliminating cholera in Bauchi State. That's at the state level. At the local government level, we equally have structures. We have what is called WASH unit. This WASH unit primarily works in providing safe water, sanitation, and hygiene in communities. And these activities are all geared toward preventing cholera.
We are part of the committee that is under the leadership of the Ministry of Health, by extension the Primary Healthcare Development Agency, to curb cholera. We are asked to support the committee in disinfecting not only wells within the metropolis, but also wastes from the communities that come out. These are chlorinated to make sure that they do not transmit cholera. And then foremost is that we make sure that the water we supply is well treated. We make sure that the water is much available. You know, with plenty of water, you can wash away cholera. But with scarcity, probably cholera has gotten somewhere to sit and infect people. So we make sure that the supply is adequate and people do get water when they need it to wash, to drink, and do other things. So more or less like trying to improve their hygiene and sanitation.
The support is not really adequate because right now the government is winding down So, and some of this emergency preparedness plan that we have developed has not been implemented. We need funds to set up those treatment centers. We need funds to pay the doctors, the nurses that will be working there. You know, I know because it's an emergency, they have to sleep there, then they will be having shifts. So we need funds to, you know, to ensure that this treatment center is running as it should be.
We make a kind of intervention in sanitizing the community, in sensitizing the community on the illness or dangers associated to open defecation. Once there's open defecation, then cholera is bound to happen in communities. So we sensitize them on dangers associated to open defecation. They take corrective measures by providing a toilet. They construct toilet by themselves and make use of them. This is one of the key determinant. This is one of the key things that help in preventing cholera in most of these communities. And for now, we are able to declare most of our communities open defecation free. There's communities where you normally see shit in the open. This has helped a lot in preventing cholera happenings in Bauchi State. Another intervention that we did was to provide a cholera kit, particularly to cholera-affected communities. We were able to provide a number of kits and distributed free of charge to these affected communities and affected households. And this cholera distribution goes with a hygiene promotion. That's sensitization. Another mechanism that was put in place is we construct tippy-tap. It's a kind of a locally made instrument that helps household to wash their hands effectively. And it's usually kept in front of a toilet. When they come out from toilet, they wash their hands with that tippy-tap. And that helps a lot in curtailing the prevalence of cholera and other diseases that are related to that. Apart from having tippy-tap, we equally provide WSP, water safety planning. We reach most of these communities that have water points. We train them on how to effectively manage their water point. And even now, the program is ongoing in some of these communities.
Cholera is a fear sanitation and hygiene related disease. Without proper hygiene and sanitation in the community, we cannot curtail cholera. Enforcement of sanitation laws, we are able to even increase the number of environmental sanitation mobile court we have. Because before we have only one environmental mobile court covering the whole state. But now we have three. The three senatorial districts now have the magistrate responsible for environmental mobile court. Yes, for the house-to-house inspections, we are doing it 4 times in a week: Monday, Tuesday, Wednesday, and Thursday. All the teams will go out based on their area of assignment, then they will do it. Then for the market, especially the issue of market that's supposed to have issue of public toilet, in order to prevent open defecation, in order to ensure open defecation free, that is the ODF. Therefore, we go to the market. If it is a weekly market, every day of that particular market, we will go to that market to ensure that people are not practicing open defecation, all with the effort of what? Ensuring open defecation free. Then the issue of what? The hotels is twice in a week, restaurants 3 times in a week. That is in respect of. Then the schools too is the whole 5 days from Monday to Friday. We normally go to the school from Monday to Friday to carry out the inspection.
We were able to set up cholera treatment centers and cholera treatment points where we supplied drugs, ORX, antibiotics to those facilities. So, and we also sensitized the communities to be going to the facilities to access care at very little or no cost.
Almost all the LGS that recorded cases then, we were able to establish CTUs in the LGS and then oral rehydration points in the communities. Even within Bauchi Metropolis here, where we have the CTC, we have establish over 20 ORPs within Bauchi Metropolis so that mild cases can be managed within their environment without bringing them to the CTC, where severe cases have been managed.
With clean water, proper sanitation, and good hygiene practices, we can make a difference in the fight against cholera.
Muna neman taimako game da gwamnati, game da wannan ƙungiyoyi masu ƙarfi na duniya, su zo su kallace mu da abubuwan da za su zo su tausaya mana a matsayinmu na talakawa mutanen ƙauye.
I think the call or action for the longer term is to say that we have to find the money. Without finding the money for investment into, infrastructure for either for sanitation or for clean water, we are not going to find a way to come out of this disease. And that investment, unfortunately, is significant. And so countries will have to find a way to include that into their budget planning. And so we call through you to say, how can ministries of finance take this seriously and ensure that appropriate investments are made in the right time frame?
For everything that is related to our health, to our development, to making sure that we have a healthy workforce that will contribute to the economy, for making sure that we have healthy citizens in general that are productive, there is no limit, in my belief, to the scale of ambition that we should have to addressing those concerns. Yes, there are distances to travel. It may take some time, but we need to get started and to be as ambitious and as strategic as we can to address those. So I don't think that an objective or a strategy to eliminate cholera by 2030 for a disease with well-known solutions, which really is all about providing water and sanitation and hygiene. Therefore, our country, our government, my agency, the Federal Ministry of Health, Federal Ministry of Water and Sanitation, and others, we do have a primary responsibility and primary ownership to look after this domestic problem, even if we are going to require contributions and help from others. We must also be seen to be doing our parts. If we do not do our part, annual cholera burden will continue to rise because we anticipate that with climate change, increasing urbanization, and all of the other activities in the environment due to our human activities, we may have continued increase in lack of access to water, sanitation, and hygiene. And these basic elements are all that we need to do to prevent diarrhea diseases in general, which is the second largest killer of children. And cholera is one of those diarrhea diseases.